So I'd just like to say hello to you all. My name's Heather Wildsmith and I work for Autism Bedfordshire. And today's topic is autism and women. And the reason for talking about this today is that when we meet with some of our focus group people, we've had a lot of feedback from some of the women of different attitudes that people have had to them, where they may be not understanding autism in women and where they've come across really negative vibes from people and people not believing them that they are autistic, down to reasons such as masking and completely different reasons. So today we're going to look at those, and we are very lucky that we've got two lovely people who are going to talk about it. So just for housekeeping, once today's over, the whole session is being recorded, and Annette, who sent the emails out, will be able to send it out to you. But it's also on our YouTube site, so you can share it with anybody who wants to watch it. It's there to be used, and it is free to be shared. If you've got any questions as we go along, which I am sure you will do, please put them in the chat, and Annette and I will be looking at that, and we'll be picking some of the questions out to ask as we go along as well. But just bearing in mind that we will have a lot of people on today, so we may not get through all the questions, but we will do our utmost to get through as many as we possibly can do. And so it is with great delight to be able to tell you about our guests. So we've got Lynette with us today, and Lynette Morgan has just taken over as the clinical nurse manager at the Autism Diagnostic Service for Adults in Bedfordshire. And she is autistic herself, and she is going to talk first of all about her professional life and being autistic and some of the issues that she's come across. And then we have Katie joining as well, Katie Gracie, and she is mum of children who she will be able to explain for herself. And what we are going to be doing is that Lynette will start off by talking about some of her experiences of being a professional within the health service, because I thought that might be quite apt for a lot of you, because you will be working alongside colleagues who are autistic, and it will raise some awareness about some of the differences and issues that could maybe be avoided, and the differences that makes to people. And Lynette's going to talk for about 15 minutes, and then we are going to have a discussion between Katie and Lynette covering some of the different topics. And when we've had our focus groups, the four things on there: late diagnosis, GPs and gynecological issues, sensory and masking, were four of the main topics that came up from the ladies in our focus group. So we're going to be covering those. I'm sure other things will get covered, and I'm hoping that we do have enough time to cover them all. So without further ado, I'm going to ask Lynette, I can't see you on my screen whether you've got your camera on or not, to join us. Brilliant, thank you. I just can't see you. And so if everybody can see Lynette, I'm going to take my camera off and pass over to Lynette to talk, and I will be joining you in about 15 minutes, Lynette, and move on to the next bit. But I am here if you want to ask me anything.
Brilliant, thank you, and thank you everybody for joining us today. I don't know where to start, because the first thing I was going to talk about was my job role, but obviously Heather's already explained that. So I'm currently the manager for the Autism Diagnostic Service. I'm a nurse by background. I trained to be an adult nurse, and then went into midwifery, and then worked in neonatal intensive care. Basically, I've been in the NHS as a nurse for around 26 years. I've also been a university lecturer as well. I was diagnosed when I was 49. And when I first disclosed that I thought I might be autistic to my manager at the time, my manager said at the time, you can't be, you've got too much theory of mind. And then later on, one of the things she'd said to me was that she described autism in the context of diabetes, and that with the right treatment and the right way of dealing with things, you can get better. So that was kind of the start of my journey from a professional point of view, which wasn't great. And one of my colleagues had also said to me, "Oh, but it's not the bad kind of autism." Bearing in mind that my colleagues have been either nurses or social workers and people of that like, or psychologists as well over the years. So it's been an interesting journey. But I choose to openly disclose that I am about my diagnosis, partly because I'm not ashamed, but also because I believe that in the NHS we should treat each other with respect and care. And as if we can't do that to each other, then I find it hard to believe that we can do that for people that come into the service. But disclosure comes with challenges, partly because people can sometimes disbelieve you as a result, fundamentally, of poor knowledge or outdated knowledge. Another reason why it's difficult is because of discrimination, both on a positive discrimination as well as negative discrimination. And something else I've experienced is that people find it intimidating, especially if they're talking about autistic experiences, and I'm sat there as an autistic representative. They don't quite know where to place me in that paradigm. So I think that creates some intimidation, and that's certainly what I've witnessed. But the reality is that when I disclose, I tend to wait for people's reactions. And from that, I can kind of decide which category they might fall into, whether they will understand or believe, whether they will discriminate one way or another, or whether they'll feel a bit intimidated or scared by it. And often this results in me oversharing, and sometimes that then results in me overanalyzing what I've overshared and a lot of anxiety. More commonly, something that I quite often do is I might withdraw and internalize a lot of stuff, and I do have occasions where I become selectively mute. Masking and mimicking are probably one of the biggest strategies of coping within a professional sphere. And it's not a conscious thing, really, because it's something that probably started before I was even really aware of what was going on. You know, the first time when somebody said, "Why do you do that? You're different, you're odd, you're strange." Before I really understood it was a coping strategy. And the risks of masking include things like burnout and bullying, because masking is on a daily basis is draining, because you're basically living in manual. You're constantly thinking and anticipating and analysing and looking and researching. So on a day-to-day basis, it's extremely draining. And you think about everything, people's emotions, what people might be thinking. It's multifaceted, it's really complex. And on a long-term basis, chronic masking can really damage your self-esteem, and actually has a lot of bad impact on your self-identity. And as you get older, that's quite important. As a female, particularly, because your roles can shift between being a parent and not being a parent, being a professional, being, you know, whatever you are, it has a huge impact, because you don't know where you stand within all of that. And there's something else around the masking and how that fits within female culture. On a kind of very generalistic point of view, I've worked in predominantly female led units where there's a sort of expectation that if you don't engage in the gossip and the small talk, that you have a sort of air of self-importance, or think you're bigger than everybody else, or that you're just really moody. And that creates quite a big barrier and makes you feel quite isolated. And it's quite hard to cope with that experience. But also there's this kind of assumption around emotions, and we know that from a sort of female perspective, if you do express your emotions in any way, you can quite often, those emotions can be minimalized, and you could be seen as being hysterical. But I think for me personally, I'm alexithymic, which means that I don't always really understand what I'm feeling or why I'm feeling or what's going on. But I also have interoceptive sort of differences that mean that those things don't marry up very well. And quite often I can be quite dissociated for quite some time from what the reality is before I actually become quite upset by a situation. And if I do, then that's when there's sort of misunderstanding about what my behaviour is, and this can create some difficulties as well. So I rely quite a lot on other people's feedback, which isn't always very forthcoming, and it can lead you to be very vulnerable. And I think there's something I really wanted to talk about, particularly in relation to the masking, but just generally anyway, because there's an idea that there are certain types of autism, and quite often people get fixated on this idea of functioning and functioning levels. And how you might come across as being very competent as an individual, as a professional, as somebody who might have risen to a certain level with your career, academically, professionally, whatever it might be, that you might be able to articulate things and be both, verbal about things that you believe in. There is an assumption within that therefore you don't really have a problem, or that you don't have any difficulties, or that there are no challenges around functioning on a day-to-day basis. And I'm here to tell you that that's not the case. And one of the things that's really important to me is that the way I manage that is that I need to step away. I have to have breaks. If I don't have those breaks, I will burn out really quickly, and my ability to work as a professional within that becomes really challenged. If you think about it on a very literal level, or around meetings and things like that, I need time to be able to step away and really process what's going on. My cognitive processing takes some time, and I can sometimes become quite interested in specific semantics and meaning. So sometimes that takes me some time to process what someone's saying. But the functioning thing, I really want people to consider that. What people might present on their face, on a face value, may be very different to what's going on in the background. And one of the examples I wanted to use was that I've got degrees, I've got all sorts of things that I could say that sound really impressive, or not maybe, but there are ridiculous things like conditioner bottles that I can't use because I simply don't know how to open them, because the instructions are so ambiguous that it stresses me out, so I won't use it. So there are things that work really well and are accessible in my life, and there are things that I find very, very difficult. And another thing, I guess I would say, is around sensory processing and interacting with people in a close environment, particularly around smells. I don't enjoy smelling perfumes and synthetic smell. So working with people, it's very difficult for me, managing that when we're working in the office. And if I'm not working in the office, I find it very difficult to read people. If I'm having to do meetings online all the time, it makes it quite a challenge as well. So there are pros and cons to it, but it would be it's really difficult for me to manage that and not feel like I'm constantly complaining about what it feels like to be working with people and being a professional. So it doesn't always feel like you're allowed to complain about these things that seem quite trivial to other people. And I think that that's something else that people don't take too seriously, because it actually will stop me from being able to concentrate, and add to that sense of burnout. So I think that's roughly around 50 minutes. It might be just under, but I'm happy to sort of go into a little bit more about stuff. But I'm trying to keep an eye on the time as well. So
you can have another few minutes if you want to, and then, or shall we bring Katie in, and then we can discuss things together?
That sounds good. Yeah. I'll mute.
Hi, Katie. So I don't know, I didn't ask you to do this, but could you just give a quick introduction? That how many children have you got?
Yeah, sure. So I'm KJ. I am autistic and have ADHD and hypermobility and a whole host of other comorbidities, just like almost every other autistic person out there. And I have 2 children who are also autistic, one with an intellectual disability and one without. So a bit of a spectrum of experience from us, and both have some other complex medical needs, again, like most autistic children. So we are frequently navigating the healthcare service in various capacities, with whether that's Great Ormond Street or just our local child development centre or your standard GP. So yeah, lots of experience.
But also at the same time, you're also running your own business as well.
Yes, yeah. So I'm the director of an educational services company for primary schools, and I deliver autism specialist teacher training for about 300 primary schools throughout the UK. So that's me.
Thank you. Just before we move on with our discussion, there's a question, Lynette. If you don't mind me asking, without going into details, have you experienced adverse childhood experiences? And in brackets, ACEs.
Yeah, I guess that depends on what you would classify as ACEs, and not from a classic point of view, but only from the autistic perspective. And I think this, again, is something that most autistic people will say, that you won't find many autistic people that haven't suffered or experienced some form of trauma as a result of being an anomaly within, or a minority within the majority. So I think not by the classic definition. No, I had a fairly standard childhood, apart from being very distressed most of the time.
Thank you.
And to add to that, I'd probably say the same, as Lynette. It's very rare for most autistic adults to say they haven't had a traumatic childhood. But statistically, we're also much more vulnerable than most other people. And unfortunately, predatory people will notice that. And so, yes, we are more likely to have experienced adverse childhood experiences as than standard population would be.
Thank you. Right, so we're going to go into our little discussions now. And the first topic is late diagnosis. And this is something I think is, would you say it's more common in women? Because women do, probably historically, because it's not been that long since it's been understood that there's more females who are autistic than was used to be thought. So I'm guessing some people, going forward, you would hope that a lot of those people will get caught a lot earlier and get earlier diagnosis. But what is the impact of having a late diagnosis? Over to you two.
So there's a fantastic book called Safeguarding Autistic Girls, and I'm not sure when the data was taken from, but at the time it was written, the average age of diagnosis for females was 36, which means that throughout your entire childhood and half of your adult working life, basically, most women will be undiagnosed. And that has pros and cons, or I guess disclosure, it has pros and cons. And so there have been plenty of times where I've had to debate, like, is it a good idea to tell somebody I'm autistic or not? And one of those scenarios in a healthcare setting is that I'm incredibly needle phobic. I again, due to sensory differences. I know it feels like a sharp scratch, and I know loads of you are going to be thinking that's such a small thing. For me, having a blood draw was worse than giving birth. Like, just to be clear, how extreme the level of pain I feel on that sensation is. I would put that higher than breaking my ribs. I'd put it higher than breaking my nose. I've broken my hand. These things do not compare to having a blood test. It is incredibly painful for me. And until I had that autism diagnosis, I was pretty much ignored when I said that. I was told I was being a baby. I was, my husband would explain when we went in for a blood test, like, this is really dangerous. She needs to be restrained. She's going to hurt somebody. And I don't want that to happen. I'm trying to protect the doctor or the nurse who's doing the blood draw. And I'm saying to them, you have to restrain me. I can't do it without restraints. And they're saying, don't be ridiculous. Of course you can do it. And it's not until you've bitten a doctor that somebody believes you. That's mortifying for me as an intelligent adult, like, to realise, oh my gosh, I just bit somebody. But when I'm in a meltdown, I'm not in control of what I'm doing. I'm humiliated by it, and I don't want that to happen, which is why it's really important you take somebody seriously when they say, I need to be restrained, I can't do this. Now, of course, I've got an autism diagnosis and everybody says, how much diazepam would you like? And what a difference. It still hurts, I'm still in pain, but I'm not going to fight you, or I can't really fight you. And again, I had this conversation with Heather during the focus group, is oftentimes when I do go in, I have to have routine blood tests for hormonal condition. Oftentimes when I go in for those blood tests, the assumption is that I have an intellectual disability, or sometimes bizarrely that I'm deaf, because I can't speak when I've taken that much diazepam, and being helped in by a carer. For whatever reason, people's assumption is that I can't understand what they're saying, but I can. I just can't respond. And I've literally had people, a nurse turn to another nurse and say, "Oh, there's no point talking to her. She's deaf." Whilst I'm sitting there going, "No, I'm not." It's just, you have to make the assumption that somebody is listening and that they are capable of understanding what you're saying. And explain things clearly and concisely, and try and make sure you've got understanding before you progress with the procedure, but do so in a way that isn't infantilizing and doesn't just ignore the patient because, they probably don't understand anyway. I don't know if Lynette wants to add.
Yeah, that was really interesting. Needle phobia is not something I experienced, so it's good to hear your perspective on that. I think it's interesting because I more readily disclose my diagnosis at work than I would if I was as a patient. Which I think says an awful lot, really, because I have experienced discrimination within work, so I know it exists in healthcare, and I think you're more vulnerable as a person using those services. So it's interesting that it's actually benefited you, but almost to the extreme. It's like they've gone too far. But I think for me, late diagnosis kind of links a little bit with what you were saying, Casey, as well as what that question was around the ACEs, because something that I couldn't escape from was the autonomy. So I also have diagnosed children, and I think what was really important to me is that those that if you get the diagnosis in childhood, you grow up with the ability to be autonomous and self-advocate. But when you reach 49 and you've never been able to be autonomous, and never really met your own needs and have learned to develop sort of internalized ableism, that comes with a whole bag or a whole luggage rack of trauma. And can precipitate crisis. So I think for me, whilst it was liberating and has helped me enormously, it's a rocky journey that needs some careful thought. The timing of mine was particularly challenging because it was during perimenopause, so my hormones were off the scale all over the place, on top of the fact that I was dealing with this sort of Pandora's box of trauma. So I think late diagnosis is something, I guess there's a sense of injustice in that as well, isn't there? Especially because I've never really thought about it before, but it was what you were saying, Heather, around the fact that, although I'm very aware of this, that the history behind autism is obviously quite jaded and from a theoretical point of view, and the concept of it being a very male specific diagnosis, the fact that it's taken over 100 years for people to actually start saying, oh look, girls can have it too, is really quite shocking. And I think that is actually quite annoying. I was quite cross about that because I've wasted an awful lot of my time, my life, hating myself, quite frankly, unnecessarily, because I've never felt like I've been able to do the things that I should be able to do, or do the things that my peers have been able to do. And it's not through lack of will or ability, it's inaccessibility and not being able to do the things in the same way. I can still get to the same outcome, but I can't do it the same way. So having that diagnosis is really important for that, because you can make sense of that and you can stop beating yourself up and saying I'm rubbish, and actually start to say I'm just me.
And also just starting to accommodate yourself even.
Yeah.
So I realised I was making cookies with my daughter about a week or two after I'd been diagnosed, and I was just feeling really frustrated and irritated, and I was being short with her. And it suddenly dawned on me, like, the radio is driving me nuts, and I had to turn the radio off. And then I paused and I went, and my hands are sticky and I don't like it, and I washed them. And before diagnosis, my thought patterns would have been, don't be stupid, you're not allowed to be upset about those things. And I would have just pushed through trying to be upbeat for my kid. Yeah. Whereas once I had the diagnosis, I was able to process in my head, okay, I'm allowed to not like the background noise. I'm allowed to wash my hands mid cooking, even if they're going to get messy again, and just relax and be a bit kinder to myself and go, these are common autistic experiences. I don't have to pull it together. It's okay to accommodate myself.
No, I totally agree with that. And I think I spent, with my older children, I spent the majority of their childhood feeling very overwhelmed. Just too much chaos, too much noise, without actually really understanding that was what was happening. And you feel so out of control, and that's not a very healthy place to be, really. So it does make a huge difference. So, once you start to really understand those things that you can accommodate for, and be able to have the vocabulary for that, because that's something that has taken me an awful long time to really understand, is that there is actually something there, and that gives you validation and makes you feel so much more part of the human race, whereas before I felt subhuman. And yeah, it has made a huge difference.
Thank you. I was just thinking as you were talking, my son's autistic, and when we were looking at schools for him, he's 20, how old is he? He's 28 or 29, he's just had his birthday. And when he was starting school, and I was asking, well, where's all the clothes pegs for the girls? Because I didn't know anything about autism then. And they were saying, oh yeah, girls don't tend to have it. And it's ridiculous when you think that, if there is two different types of brain, why would it go
Oh,
I think we lost Heather.
Frozen a bit, isn't she?
She's frozen. Oh dear, where's she gone?
I don't know. Hopefully she can come out and come back in again.
To put that in perspective as well, when we were looking at alternative provisions for my daughter, one of the alternative provisions we were looking at was saying that they had a high rate of girls in the school, like compared to other specialist autism schools. They had more girls proportionally. And I asked how many girls would be in her class, and the answer was 0. And how many would be in her year group, and the answer was 0. But there were more girls in that school across all the year groups than there were in most autism specialist schools.
Interesting.
Yeah. And I think you do tend to have more females who are more academically minded, who are autistic, and the more analytical, would you say? I mean, you two are sort of shining examples of that.
I mean, I think there's just massive diversity across autistic experience in general. My girl would not be on the high academically achieving group, but there's lots of things we have in common. It's just academics isn't one of them.
No. Yeah, but I think it is a thing for people to know that even if somebody, because I think you're more likely to come across an undiagnosed female, and it doesn't mean to say if somebody is displaying anxiety and everything else, for professionals to think again, and just because there's no diagnosis there, to still be thinking and how can we make this person feel more comfortable with or without that diagnosis, if it is something and like turning that sound off.
And that's what we say when we're talking to teachers, is recognizing that the average age of diagnosis for girls is 36. Most of the autistic girls in your school will not be diagnosed, and there is no harm done when you treat a neurotypical child as if they are autistic. It doesn't hurt them in any way, but it does autistic girls when we treat them like neurotypicals.
And it's just meeting needs, isn't it? Meeting needs of people regardless of a label. It's just meeting need.
Yeah, reasonable adjustments aren't expensive most of the time, and if you go into something like a school classroom, for example, they are quite often noisy and chaotic, and it's not just the autistic children that are going to find that overwhelming and hard to concentrate in. So yeah, there are things to do.
So can we move on to talking about GPs and gynecological things, because and it's also experiences of having children, or giving birth, going through pregnancy when you weren't diagnosed as well, so you didn't know about everything that you do know now. So I am just going to turn my camera off and just let you two talk, because this is going to be very interesting.
Do you want to go first on it?
I don't mind. This is an area that I've covered quite a lot across lots of different spectrums, because my previous professional career was neonatal intensive care. I've done midwifery training, and I worked in perinatal mental health. I'm also part of a maternity autism research group, because this is an area of my particular interest. When I worked in the perinatal services, there were a lot of autistic and ADHD females there in that service, and it was at that point that I started to say, hang on a minute, I recognise this, and that was how I'd recognised my own experience in them. But it also kind of made me realise that pregnancy and birth is clearly going to be an incredibly challenging time for autistic people that have sensory processing differences, and amongst all of the other things that go on. So I could probably hog this topic quite a lot, and I don't want to do that to you, but from a personal point of view, my main example that I use as a starter for 10 is when I had my last child, bearing in mind my professional background and understanding delivery and birth, and I'd had 3 other children by this point. I'm having to rethink that. I birthed 2 other children at this point because one was a stepchild. Sorry. I knew exactly what my labours were like, and when I presented to the midwife and said I have very quick deliveries, I said I need to push, and she said no, you don't. And the reason she said that, and I know this from because it was obvious, was because I just sat there with a very blank face saying, I need to push now, I'm ready. And she didn't get that actually I wasn't experiencing pain in the way that she would anticipate, and I wasn't responding in the way that she was. So that incongruous kind of presentation is something that when I surveyed women, because I did a talk for the Royal College of Psychiatry some time ago on this topic, and when I surveyed women, this was something that came back almost unanimously, that there was this massive mismatch between how you feeling things in the moment, a sort of dissociative almost experience. And certainly within the perinatal service, many of the women described that as being one of the precipitative factors for mental health problems following delivery, because they felt so dissociated from the whole experience. So that's something that I think needs much more research in. And women have delivered at home on their own because they weren't taken seriously because of their presentation. So yeah, I'll let you say, and then maybe we could kind of go back and forth.
And then we can move this. So sort of 2 real sort of standout things for me that I think, had I had a diagnosis, would have gone quite differently, was during my first child's delivery, whilst I was under an epidural, my hip got dislocated by doctor manipulating my legs, I guess. And nobody was aware of that. And so the next day, we had like a 19-hour labour, ended with an emergency C-section. And they've got the morphine drip, and they're telling me I have to get up and go and get my breakfast from another room. And I'm saying I cannot walk. And they're saying to me, you must walk. It's really important. And they explain about the scar tissue, how it needs to move and things. And I'm saying, but my legs, I can't walk. And they were saying, you have to. And this went on actually for nearly 2 days. My husband brought me some food in, and a nurse took it off him and said, no, she has to get up and walk. So I'd just had a 19-hour delivery. I had surgery. I hadn't eaten prior to the delivery either, because I was told you shouldn't eat because of not wanting, in case you have a anaesthesia, which obviously I did. So I hadn't eaten in almost 3 days by the time somebody actually came and assessed me and said, actually, there is something wrong with this leg, took me down for an MRI and said, you've dislocated your hip, we're going to have to put it back. And suddenly, here's all the food, we're really sorry. But the thing was, no one believed I was in pain because my face was too still. And I'm more likely to have a very still face when I'm in pain, which is stupid. Like, that should be when I look most emotional. And yet, for some reason, that's not what my body decides to do. And it's not natural to me. And, I now recognise I have to act a bit to make you believe me. But then I feel like imposter syndrome. Am I acting? Am I faking to make the doctor believe me? And it's not that serious. So it's really, really difficult to work out, how do I communicate pain to you in a way that is honest, but that you will still understand that I'm in pain and how serious that pain is. Because I'm either being told, you're being over the top, you're being dramatic, it's not that painful, or I'm being told, well, you don't look like you're in any pain. And trying to work out how do I find that line is so difficult. The second thing that I think went really differently than maybe it needed to was that I called my GP during my pregnancy and said, I'm a bit concerned that I've got postnatal depression. And she said, well, send a health visitor around. And a health visitor came around and explained to me, you can't have postnatal depression because that happens after. Postnatal means post-birth. And I was like, oh, okay. well, I don't know what's wrong with me then. And she was like, well, tell me what's wrong. And I said, well, my husband, he's like talking to the bump and like, singing to the baby and telling it how much he loves it. And I don't feel anything, except, if I'm honest, a little bit repulsed by movements. And when it kicks me, I feel nauseous. I keep getting images of, the movie Alien, where it like bursts out the stomach. I was having nightmares that every time my baby moved, I was like, oh God, it's going to rip me open. It was such a scary time for me. Sensory wise, it was very odd. My hormones were all over the place. I just vomited constantly. I had really bad hyperemesis. I lost about 3 stone in my first pregnancy. And it just, all of those things, it was just a really challenging time. And so then when everybody else is going, this is such a joyful, loving time, and my experience was, I feel nothing. My thought process was, then there must be something really, really wrong with me. So I ended up getting a community psychiatric nurse, and ultimately, lots of things, lots of interventions, which now I think probably wouldn't happen had they known that I was autistic, partly because I probably wouldn't have even rung my GP and said, I think I've got postnatal depression. I would have just accepted that, okay, I feel things differently, or I'm not as aware of things. But knowing that my experience was so different to other pregnant women's and not understanding why made me feel like there's something really wrong with me. I must be a psychopath. And I spent most of my pregnancy worried that I was going to need to be sectioned. And what if I don't love my baby? Now, the truth is, once he was born, absolutely adored that baby. And my anxiety that something would happen to him was so high that really was why I needed the CPN in the end. But my fear was, I'm a sociopath because I don't feel the same things that other people are telling me I should be feeling. And so I feel like it's really important for autistic women to understand that pregnancy doesn't feel the same for everybody, and it's okay. And that's, I had the same with my second. I didn't feel anything whilst I was pregnant with them, and then loved them, adored them, obsessed with them once they were born, but just couldn't feel that connection during pregnancy in any way.
That's really interesting. A lot of, if it's any consolation, a lot of the women I spoke to that I surveyed before said that they had very similar experience to you around that kind of not feeling, almost feeling quite disgusted. And I've tried to explain to professionals in the past about not being judgmental around that, and not, trying to sort of come alongside the woman to sort of understand that how difficult that must feel to have that experience, and not feel like you're matching what other people should be having, or feel, like you feel like you should be having. But it's really common, actually. I think for me, I was just totally dissociated, so I didn't really have any of that particular experience that but yeah, it is really common, and the hypervigilance was massive for me also postnatally. But I had, with my last pregnancy, I had a huge amount of anxiety because I was older when I was pregnant. So, but they never took that seriously, and they never took it on board. And I think similarly for you, really, to you, in that I think if they'd known, and I'd known that I was autistic, they may have recognised that I was going to go completely into they could have asked some more questions, because I was a neonatal nurse, and I was an older woman who was pregnant, and obviously I knew absolutely everything that could go wrong to far too much a degree. So that became my preoccupation throughout my entire pregnancy. And when I finally delivered, I became so hypervigilant to neurodevelopment that I became obsessive and developed OCD as a result. And that's not hyperbole. I literally developed that as a result. So, and I think, obviously sleep deprivation could be as a seminar all on its own, I think, because I don't think people acknowledge just how impactful that is for any new mum, but for autistic people, it can literally turn your world upside down. I'm not a great sleeper anyway, but to be that sleep deprived, it doesn't do your mental health much good, because you need time to process. You need time to just recharge your batteries, I guess, or whatever theory people like to use, spoon theory, or whatever theory you like to use. You know, I think that's really important for people to understand. And the other thing that some people have said is because they have such an aversion to touch, even holding the baby, for some people can be really difficult. I didn't particularly have that problem, but my eldest child hated being held, and used to cry all the time. So I didn't know they were autistic, and I didn't know I was autistic, and we were in this kind of awful rejection sensitivity loop, and attachment went out the window, and it was all a bit messy. And you know, for my youngest, she was the opposite. You know, I couldn't put her down, and it was totally overwhelming and suffocating. So it's a challenge. It really is.
And whilst you're struggling with sleep deprivation, you are much more, in my opinion, likely to become overstimulated by various sensory inputs. And that can be like, touching all the time. I had one that wouldn't be put down, like carried them in a sling until they were like you know, just could not get down without screaming. And I think, you know, oftentimes as parents, you feel a bit guilty, but honestly, earplugs, like, not complete blocks, but ones that dampen sound. I wish a visitor had recommended that to me. I'm such a nice mum when the volume is just reduced. It doesn't need to be silent. I can still hear my child, but I can dampen that sound with an earplug that reduces, or even just reduces the distortion, like the Flare Calmer ones that just stops the noise around. It just reduces that sensory overload and helps me stay calm. But attending toddler groups and baby groups when you are neurodiverse is already sensory hell. Everything
my goodness.
Kids banging things, bells, jangling tambourines. It's awful. Now add in that I'm sleep deprived and I'm being told by a health visitor I need to go, it's good for my mental health, it's really important, we need someone to keep an eye on the baby.
You can see them scribbling it down in their notes if you don't go.
And I do understand from a safeguarding point of view, if I've told you that I think I'm, you know, what if I'm a psychopath? You know, I've made that allegation about myself. I do understand that you want me to be seen and be out in the house regularly, but an understanding that, okay, for some autistic women, that recovery period after birth, particularly traumatic birth, is so important, and overstimulating us with lots of things that we have to get out and do is really unhelpful. And you know, maybe a home visit would be better from a health visitor than
I just want to interject there, because speaking as a neurotypical mum who was sleep deprived, I was only sleep deprived. I wasn't spending my day masking and spending all the energy that you both would have been spending doing other things. So I think it's important for professionals to know there is a big difference between a sleep deprived neurotypical mum and a sleep deprived autistic mum. Because I know I didn't realise how sleep deprived I was until I got sleep, and then you realise how little you were working on. But I think all the other things, all the sensory stuff and everything else that you're dealing with on a day-to-day basis that can be really difficult, as well as any new mum hasn't got a clue how to be a new mum, that you're having to work all that out as well and deal with everything else going on, is just so much more difficult for an autistic mum or a non-diagnosed autistic mum. So I just wanted to add that in. Would you like to move on to sort of talking about GPs and that? Because I think in the focus group it was talking about having like extended appointments and how to communicate and everything else within the GP system. I I'm going to pass over to Katie to start that one off because she is in that groove.
Yeah, so a lot of us find the GP system and communication quite challenging. My preference almost always is to use eConsult because I hate having to pick up the phone. I feel stressed and anxious every time I have to phone somebody. And so I'm really happy to just type my answers in and use eConsult, which is great when eConsult works. Unfortunately, my experience is that a lot of the time eConsult then says, I can't safely assess your symptoms, call your surgery. The problem is by the time I've gone through eConsult, everybody else on the phone lines is in the queue already. So when I join it, I wait for ages and then I'm told there's no appointments left to ring 111. 111 always tell you they can't safely assess your symptoms. Please go to urgent care. And then urgent care are going to tell you, all we can do is pain relief or antibiotics because we're not your primary doctor. You need to make an appointment with your GP. So it becomes this absolute nightmare to just get a normal, I just want to walk in and see my GP. I know that's not possible in, with funding and the system that we're in, that these are the sorts of challenges that they're there. But I've literally gotten to the point where I started writing my GP letters, like literally snail mail, like type or write a letter and post it through the door, because it was the only way I could get them to communicate with me. And the response to that was always, please don't write letters, it takes us much longer, you should use eConsult or phone us. But when the phone lines and the eConsult feel so inaccessible, you end up kind of going, well, the only way I can circumvent the system is to write you a letter. And I appreciate that's not that helpful and GPs don't like that. But that's kind of just where we're at. Once I've got an appointment, if I do manage to get through to get an appointment, the sort of 10-minute slot that you get, I appreciate, again, you're trying to pack as many appointments in as possible, aren't you? So, running the system as efficiently as possible, you try and minimize everyone's appointment time. The challenge is it's never really a 10-minute appointment because the GP's got to type things up, they've got, to request blood forms or whatever. And it feels like you're always under this time pressure of, I've only got a few minutes, I need to tell you everything. And the response is, you can only talk to me about one thing in this appointment. Now, we all know, don't we, that if your body is a system, and if one part of the system malfunctions, it affects other things too. And bearing in mind, I'm not a doctor, so I don't know which of these symptoms are related to one another. And it's incredibly frustrating when you do finally get to where you're trying to get to, and the response is either, this is normal, why are you complaining about this? Or, why on earth didn't you talk to me sooner? I should have heard about this from you months ago. And I'm not a doctor. I don't know what's important to tell you. I'm doing my best. But if I try and tell you everything and I hear, no, I only want to hear about one symptom, I might pick the wrong symptom. And then, 6 months down the line, it's really frustrating. Well, how could you have diagnosed me? You didn't have all the information. You didn't want me to give you the information. So it always feels like we're struggling to navigate these conversations where, one of us knows what information they need and the other one doesn't. And the one that doesn't is the one that holds all the information and can't communicate it. So Heather's been great. She's pointed me towards a health passport that you can fill out and have all your information ready so that you can hand it if you go into urgent care or if you go into A&E or something like that. Honestly, it probably would be really helpful, but every time I look at it, I feel overwhelmed and I don't know where to start filling it out. And so, yeah, those are sort of the main challenges. And then again, like just not being believed because my face doesn't look like I'm in pain, or I've had when I've requested notes, I've had literally in my notes it's been written about me claiming to be depressed but doesn't show any signs of low mood. And I'm like, how about the fact I'm telling you that I feel depressed is a sign of low mood? I've also had in the same appointment letter, in the same notes from an appointment, it's stating that I didn't show any symptoms of anxiety or low mood, but also Mrs. Gracie was tearful and found it difficult to explain her symptoms. Well, how can I be tearful and not be showing any signs of low mood? It doesn't make sense. But something about the way I'm being experienced, the way I'm presenting myself, is making people not understand what I'm trying to convey. And when we talk about masking, I always think to myself, I think I'm brilliant at masking. I think I'm really, really good at masking. And I think that I come across exactly how I mean to. However, the people closest to me tell me that's not the case. And in truth, when I read something like that on my medical notes, is when I realise, oh, I guess it's not the case. I think I'm doing the right face and showing you the right things, but there's a disconnect in our communication, and that makes it really, really hard to get good medical care from your GP, particularly when you're not seeing the same GP regularly. When I was younger, despite being undiagnosed, I had the same GP because I lived in a tiny village, and Dr. Chrissy would see me every time, and actually communication was really good, even though she didn't know I was autistic. Living in a bigger town where every time I see my GP so I've changed GP surgeries 4 years ago because we moved house. I don't think I've seen the same GP more than once. In fact, I don't think I've ever had the same GP for an appointment in the last 4 years. And that's across me and my children and multiple conditions. So that should tell you how difficult I'm finding this. Lynette, I'll hand over, or I'll keep talking.
It's fine. I mean, I think you probably your input's probably a lot more valuable than mine. I think it's so bizarre because this topic has come up so many times that, and this morning I was talking with somebody about it, and more recently, and I know obviously there's been an awful lot of research. Mary Doherty has done loads of research around the barriers to accessing GP surgeries, but for autistic people. But I think as a health professional, I definitely know that my GP takes me a lot more seriously than I think he would have done if I wasn't. And I tend to go in and say, give him. I don't give him the symptoms. I give him the cause, because I think that it kind of goes back to what you were saying before around people. People get fixated on behavior as a way of analysing what the problem is, and that doesn't work when you're working with autistic people, because behaviours aren't going to fit within that kind of normal trajectory of behaviours. So, you know, what you need to do is be curious and ask questions. I think prior to being a nurse, I know for certain I wasn't taken seriously, apart from the fact that up until I hit menopause, I looked a lot younger than I was. And I think that there was this assumption that I just was a 15-year-old who didn't know what they were talking about. Probably still act like a 15-year-old that doesn't know what they're talking about, but at least I can throw my title at people and people tend to listen a bit more. But I think the reality, it shouldn't be like that. You know, if you're saying this is what you're experiencing, then this is what you experience. It shouldn't make any difference how you present. That they're not there to analyze that. They're there to listen, and then to sort of utilize that information to treat or refer on. And that bothers me a little bit, that people don't think about it like that. You know, that people are so fixated on behavior and don't listen to the words. And I've seen that very much as a nurse working in NICU. You know, when parents used to say, my baby doesn't seem the same way as they were before. You know, what you have to listen to parents, because even though they know their child, even in that very short period of time, they know their child, and normally they're right. And it goes the same for patients and parents and carers in any context. They should always be listened to. They might not always be right, but if you don't listen to them, you'll never know, will you? So but what I would say is that in spite of all of that, in spite of me being a nurse and feeling like I am taken quite seriously most of the time, I don't contact my GP half as much as I should, because I can't stand the experience. I don't like going to the GP surgery. I fret about absolutely everything. It took me over a year to go and see them about something that was potentially quite serious, and that there are things like that all the time, because the stress of that interaction is so high that I just avoid it, and I will just not pretend it doesn't exist, but just avoid it and manage it. Like I have to manage everything else, don't you? Right? Like you live with so much pain and so much discomfort in your daily life. You just learn to slot that in with all the other library of unpleasantries that you live with.
And the other thing that happens is, if you do experience significant health anxiety, and I do, like partly because I'm always scared they want blood, because 9 times out of 10 when I visit my doctor they want blood, so I'm always afraid to call them when I'm sick, because oh no, they're going to want to do a blood test. And so if you actually see me in your surgery, it's because I have battled for sometimes weeks or months with myself to make myself book that appointment.
Yeah.
And we've got to the point now where my GP will withhold medication until I have a blood draw, because we need you to have this blood draw. Well, that means I sometimes go 3 or 4 months without medication because I'm avoiding booking that blood draw. And my endocrinologist is going, what do you mean you didn't take your medication for 4 months? That's absolutely insane. You have to take it. And I go, well, I couldn't get it. Why couldn't you get it? Well, because the GP said I needed a blood test. It's that those sort of avoidant behaviours. I'm a sensible adult. I'm 42. I should be able to do this, and yet I can't make myself do it. And so by the time I get into the surgery, my communication is at its lowest functioning level, because I'm already stressed and anxious about being here, and I'm worried you're going to ask me for blood. And so then it's really hard for me to answer questions on the fly and give you honest responses. When I'm scared, I am more likely to comply with anything you say and just go, okay, and not give you the honest response, because I'm trying to get out of here as quickly as possible. And so if you've got a patient who's coming in and you know that there's significant health anxiety or stress about seeing a doctor, and for reference, when I went into labour with my daughter, they put me on I don't know what the monitor's called, Lynette will know, but the monitor that tests how many contractions you're having or something.
Yeah, CTG.
I wasn't in labour. Every time a doctor walked into the room, I wasn't in labour. But when they left, my contractions would start up again, and they would come in heavy and hard. But the moment a doctor or a nurse walked in the room, they would stop completely. And we ended up again just having to have another section because I couldn't labour, because my anxiety prevented my body from being able to labour with a doctor in the room. That's how extreme my fear of hospitals is. And yet you wouldn't know that when I'm sitting in the hospital trying to tell you about my symptoms.
Can I just ask a question? There's a question come up in a chat. For those with suspicions that they are neurodivergent but undiagnosed, is it worth being diagnosed? If there's no cure and if there's no cure and people know how to manage their symptoms, etc., what are the benefits of a late diagnosis?
It's about identity. It's about having reassurance, validation. There's so much to it, so much more.
But it's also about getting good healthcare, because we know that there are lots of comorbidities that autistic people struggle with. And we also know that we're just more sensitive to things than some people. I started a medication recently on the lowest dose possible, because they were going to build up from there. And I had such an extreme reaction to that medication that I ended up in A&E. And they have now halved that dosage for me. I get it made at a pharmacy, and that's fine. That works for me. Now, apparently, it shouldn't work. I should need a bigger dose. But my body, I react to everything. constantly, if there's side effects listed on a medication, I'm probably getting all of them. And so knowing that I'm autistic helps me and my doctor discuss, okay, well, do I really need to take this? Because there probably is going to be an adverse reaction and we have to weigh up the pros and cons. Whereas for another patient, they're just, they could just willy-nilly prescribe it and it wouldn't be a problem. So I think it is really important to recognise that, I know Lynette says she prefers not to be around people with strong perfume. I get migraines if I'm stuck in an office with somebody with strong perfume.
No, I do. I was being polite.
yeah, I thought you might be. And so when we recognise that our bodies are just really much more chemically sensitive than most people, and sometimes undersensitive, it helps to recognise, it helps to understand, like, sometimes that your medical care might need to be more or less than a neurotypical person, and it's okay if your body doesn't respond exactly the way it's supposed to. It doesn't mean the medication's wrong. It might need adjusting. And I wouldn't know these things or be able to have those conversations with my doctor if I didn't have I'm autistic, particularly because I think there's a culture now of it being seen as trendy for women to get diagnosed with autism or TikTok diagnoses. Well, bearing in mind that we've just discussed the fact that most women aren't diagnosed by the age of 36, a lot of these people are right that they're autistic and they're not diagnosed. And so when we roll our eyes at people who think they might be autistic and go, oh yeah, everyone wants to be autistic now, we're probably actually ignoring people who really are autistic. And so personally, I think getting a diagnosis is really important, just to get taken seriously when you want to have those discussions about what your needs are and get them met without somebody rolling their eyes at you. Now, I know in an ideal world that shouldn't be what happens, but the real world that we live in is that people do make a judgment about you. If you say you're autistic and then not diagnosed, in brackets, people are making judgments about you.
They very much do. So you're right, and I'm pleased you sort of interjected there, because I don't have loads of medical things that are really sensitive to that, but the medication thing is a huge thing. I've seen that a lot in my practice, but for me, I would talk more from the psychological point of view, because that's 100% been one of the biggest assets for me is having some self-acceptance and being a little bit more compassionate with myself and being able to give myself the adjustments within my life that has made me function better. It's meant that I've been able to engage in things that are more meaningful to me than trying to force myself into a shape that's doesn't fit me, which is essentially what I've been doing my whole life. And without that validation, I don't think I would have survived much longer. I was living on a thread, and it was destroying me. So I understand when people say, well, if we just met everyone's needs, it wouldn't be necessary. Well, actually, it's a bit more than that. We do need to meet people's needs, but we also need to accept that within the massive diversity of neurodevelopment, there are people, minorities within that have ways of processing information and communicating differently that will never change, and that's beneficial to humanity. So I kind of think, well, that diagnosis allows us to embrace that, I feel, rather than trying to erase it. I think that's really important. I know somebody's written quite a good response to that as well. So really, really important stuff around the diagnosis.
Just want to say thank you to Georgia, because she's put in, as someone who was diagnosed just last year at the age of 33, I can say it is absolutely worth getting diagnosed. I won't be able to fully explain how important it is just in this comment, but in short, it gave me an answer as to why I gone my entire life feeling like I didn't belong, trying to work out why I wasn't able to fit in, even though I was trying everything, and why everyone else just seemed to get stuff that I didn't. On top of all the sensory issues, which I now have an explanation for, it has enabled me to give myself more compassion to help with a lifetime of low self-worth.
Yeah.
So reiterated what you both
really important.
And honestly, it changed my marriage as well, because my husband is one of the people who would say I'm bad at masking. He can tell immediately when I'm discomfort, sometimes before I can. Like, he used to say, I think we need to leave now. And I would say, why? And he'd go, I think you've been out for a while. I think we're done. And I'd go, no, I'm all right. And then I'd crash later. And he'd go, I told you we should have left half an hour earlier. And I'd go, well, how did you know? And he says, well, your breathing changes and your lips get blue. And I can just see like your eyes are a bit glassy. And he's more sensitive and aware sometimes of what's happening in my body than I am, because I can't see those things and I'm not feeling those things. And when we talk about not recognizing sensations in your body, for some of us that's really extreme. I can't tell the difference between, we've joked about this before, but I can't tell the difference between when I'm thirsty, if I'm going to vomit, or if I need a wee.
Yeah,
like
I knew you were going to say
it's just pressure. Right, it's just pressure in my body, but I don't know what it is. And so the first thing I'll do is try and go to the toilet, and if I can't wee, then I'll go and have a drink. And if I needed to vomit, what happens is I will then vomit in the sink. So I stay near the sink with my cup of water, because I'm going to vomit immediately when I drink if it was vomit. But they all feel the same. So as a child, I was constantly being hospitalized for dehydration. At least 2 to 3 times a year I'd get hospitalized for dehydration, because I just don't know when I'm thirsty. And so I had to watch an alarms beeping all day to tell me it's time to have a drink. All those things that you might take for granted as just knowing what your body needs. I don't know what your body needs. And my husband understanding that and being told explicitly, oh, this is what her experience is now one of my greatest caregivers for saying, hey, I think it's really loud in here. Are you going to get a migraine? Because it looks like your eyes are getting a bit, and having that awareness and that ability to look after and support me, we wouldn't have had a language or understood what was happening if we didn't have that diagnosis to help him understand, like, oh, okay, I need to look out for those things because KJ won't.
Yeah, thank you. Somebody's asking, saying, first of all, this is very interesting and informative. I work for older adults age group, which is 65 and above. Any resources around that would be very useful. I'm currently working very close with a lady who was misdiagnosed, but sounding very familiar listening to Lynette and Gracie. Any resources, help, advice would be very useful, which will be useful for those who have never been diagnosed with autism. Are any of you aware of any resources around?
Yeah, there's been quite a lot of work being done by Cos Michael. I'll find her details and share that in the chat, because she's been doing leading work on an older adults, which I hadn't realised until fairly recently that I fell in that category, which is an interesting experience. I
met Cos Michael just after she was diagnosed.
Did you?
And she was saying to me that there was a little shop near where she used to live, and the man in there was really grumpy with her. And so this is a lady who was diagnosed in her early 50s, and this guy was always grumpy with her, but he was really nice to other people. And her sister said to her, have you ever thought of going in and putting a smile on your face before you walk into the shop? So she did, and the man was nice to her ever since. And she said she had never even known that her face looked different. And so she physically put the smile on before she walked in. And so when you meet her, she will smile because she's now been taught that is something to do, and you get a very different reaction from people. So it's, yeah.
That's really interesting, because I've frequently been told to smile more, and then when I do, I look quite unhinged because I'm just because I don't really know how to gauge it really. So yeah, that's really interesting.
People ask what's funny, why are you smiling, like there's a joke that they haven't understood, and I'm like, no, I'm just trying to make you be friends with me.
Awkward, right? Don't do it like that, you look mad.
We're just coming to the last 10 minutes. The last two topics on this list that I've got are sensory and masking, and I think you have been talking about that as you've been talking through. But another thing, Lynette, that you mentioned the other day was about burnout, and I wondered whether that is something that we could just maybe talk about in the last few minutes.
Yeah, I didn't mention that earlier really much, did I? Yeah, I think, I mean, going back to what I was saying before, that to me, the way I see it is that there are two ways that we mask. We mask, everybody does it, but on a daily basis. When you are constantly being vigilant to absolutely everything and analyzing everything around you all the time, it is extremely exhausting. And because you don't have the usual feedback to understand whether, a bit like what you were saying, you don't have that usual feedback to say whether you're actually presenting as okay or not. You are responding to other people's behaviors to you, even though they might not actually match what you're trying to put across, and that is all very energy consuming. And if you layer that up with the pressure and the commitment of daily life, be it around work, just being at home, doing you whatever it is that you do, being a parent, whatever those things are, alongside your own personal anxieties and analysis of the situation. Generally speaking, for me, that results in just you become less and less able to sort of expend any energy on anything. And I guess the best way for me to try and describe it, because I don't think I'm doing a very good job at the moment, is my own personal experience of burnout was quite catastrophic and came at the end of a period of time where I was experiencing some workplace bullying. And I wasn't diagnosed at the time, but I was high masking. I know I was, based on reflection of that time, because I was working in a predominantly female environment, and was being told that I was grumpy because I wasn't engaging in that sort of gossiping and talking about other people and the usual chit chat. And the more of those things happened, the more I became very tired, because the more I was trying to pretend that I was okay when I wasn't. And that just took its toll on me. I think it's complex. I think it sounds like a really simplistic term for something that can be absolutely devastating. It for me destroyed my career at the time, and my whole life felt like it imploded. It was totally overwhelming, physically, mentally, and it took me absolutely years to recover from. And now what I find is that if I don't take good steps to self-care and self-manage, I have what I would say are more like mini burnouts. And I find myself every 3 to 6 months hitting a point where I'm feeling more and more tired, like I'm wading through treacle almost. It just feels so exhausting, because I'm still having to pretend all the time, when I don't feel okay all the time. And I don't know how, I don't know what I'm supposed to do about that, really. But I'm just very aware of the fact that I need to take time, and that makes me feel rubbish, because as a health professional, I feel like the NHS can ill afford to deal with somebody that needs space and time every few months. It is 3 to 6 months, but it's either that or I won't have longevity in my career, and that's the reality of it. And I've been quite explicit about that to people in the past, when I've said I don't know how much longer I can do this. I'm 52 nearly, and I feel okay for only a small percentage of the year, and the rest of the time I feel like I feel like sleep deprivation's hit me again. It's that kind of feeling. It's that level of exhaustion. It's mental fatigue as well as cognitive fatigue and physical absolute exhaustion. I really don't know how else to put it. So I think, as you said before, Heather, there are going to be colleagues that, like me, have that experience, but there will be people coming into services also that will try to explain the sheer level of devastation that can have on your life and how it can cut your career short.
And so I can't remember where the research I read was. If I remember, I'll tell Heather so that she can add it to notes. But what I read was that the average autistic adult, and bear in mind we all have different capacities, but on average an autistic adult can work sustainably for 19 hours a week. And bear in mind that 19 hours includes housework and cooking, meals, etc. And so the research was saying that basically when people are contracted to work full time, what happens is they get in a cycle of burnout every 3 to 5 years. Now, that has been 100% my experience. I first experienced burnout in university, and for almost, I ended up in hospital during Freshers' Week of my final year, and I, for the next 2 years, slept between 18 and 21 hours a day. And so 2 years. And ever since then, I have been managing burnout. I'm 42 and I've still never been able to hold a full-time job. I can work part-time sometimes and not always. But if I am working, even part-time, my house is falling apart and I have no social life. Like, I have to choose between having a job and having a social life. Those aren't things that I'm allowed to. My body will not let me do both of those things. And so when you go to your GP and say, I can't really explain my symptoms, but I'm exhausted, I can't think sometimes, I'm so tired, and yet I'm staying awake because at night is the only time when everything is quiet and I can process all the things that happened today that I didn't have time or space to process that happened to me. And so you end up staying awake just because, it's finally peace. But actually, it's just exhausting.
Thank you. So we've only got a couple of minutes left, and I've just found some more questions in the Q&A. So this one, very short answer, please. But hi, I'm very newly diagnosed, 1 month. I work in a heavily clinical setting in operating theatres. I worry about disclosing my diagnosis due to fear of discrimination, and I have no idea how to approach this situation. Any advice? I don't know if you can do that quite quickly.
Yeah, I was going to say, I don't know that necessarily there is. I mean, gosh, disclosure, you need to feel comfortable in doing that. There is no pressure to do that. You're not obliged to do it. But if you feel that you should or you want to, then that's entirely in your hands. But I think if you've got a line manager that you feel is supportive, then obviously that would be your usual person. But if you're concerned that they might not understand or it might not be handled well, then there should be people within the trust that you could contact, even within the occupational health or whatever they're called within your trust. There should be people that you can speak to, but there is advice around there about how to gauge when or if it's appropriate to disclose. But it doesn't have to be. There's if you don't feel comfortable and you don't feel safe, then it's not a necessity. But I would think you
need to get comfortable with your own diagnosis first.
I would say so. I would say so.
Oh, well, thank you both so much. I just want to finish with one message that's on here. I was diagnosed with ADHD at 36 in December 2024, and it has been life-changing. First time I felt validation in my life that I'm actually normal and there's an explanation for all my quirks and sensory and emotional sensitivities. joining today is the first time I've actually had a realisation that I may also be autistic too, which is another wow moment for me, not just as a health professional, but as a woman and human being. It was KJ speaking about being pregnant, as I've had the same fear since a teen, and everyone said I'm weird for thinking it's disgusting. This has been such an informative session, so thank you so much. I work in specialist eating disorders as a senior CBT therapist, so lots to think about and take away to help our service users. So, yeah, I thought that was quite a nice one to finish with. And I just want to apologise to people that there are quite a few more questions that we just haven't had time to fit in.
If you can collate them, I'm happy to respond to anything.
Okay, thank you. Somebody was asking about what the book was that was mentioned at the beginning. We can put that in to the follow-up email when Annette sends the link out to the recording. But to you two, thank you so much. I think it's been riveting. I've heard you both talk before. We've been chatting all the time, but it's still so riveting hearing you both. And I hope that, for those of you who have been listening in, that it has given you a lot of food for thought, and that you're able to share some of these experiences that you've heard with your colleagues, that you can find ways of implementing change, even if they are small changes, because quite often it's small changes that have big impact. So thank you all, and just get on with the rest of your day. But thank you for Lynette and Katie. Just thank you so much.
Thank you.
But yeah, and so the email will be coming out with a link to this when it's all sorted out. But thank you, everybody, and bye for now.
Bye.
Thanks, Katie. Thanks, Lynette.
Very
welcome.